Well, good evening. Good evening. God bless you. This is Apostle Gretchel Dixon, all the way from the beautiful state of Texas. It's a little warm here, but nonetheless, we're here on purpose doing God's work. I have a very special guest with me tonight. It is Dr. Kia Everett, all the way from the East Coast. So, good evening, Dr. Everett. Introduce yourself and where are you located?
Good evening. Good evening. Thank you so much, Apostle, for having me. I'm so honored. I'm Dr. Kia Everett. I'm a licensed professional counselor, and I am the founder and CEO of Finding Your Way Mental Health Urgent Care Center, the first mental health urgent care center in the Mid Atlantic region. We are 7 years old. We celebrate 7 years in December, and we are located in I'll say Springfield, Pennsylvania, Seacane, Pennsylvania, which is Delaware County. And we are, we service people on an urgent, um, more immediate basis for mental health. Our tagline is "Your urgent need is our top priority," and so I'm excited to be here tonight. Thank you so much for having me.
Well, I couldn't wait to get you on because I wanted to find out more about it because when I think of urgent care, I think of, I'm feeling not feeling well, or I may have thought I sprained an ankle and I go to the urgent care, which is a lot faster than going to the hospital ER. So, how does what you offer mimic the medical urgent care, or what is the mental health urgent care that you offer? How does that work?
Absolutely. So you're exactly correct. So we actually model the medical, physical, urgent care. Let me just give you a little background. So when the medical or physical urgent care first started, that is actually where I kind of modeled the mental health urgent care process from. I had taken my daughter one day, and I was really impressed how they processed us through, and how literally everything you needed was under one umbrella. So
Mm.
they they weighed her. The doctor came in, saw her. We were actually able to get the medication. I think she had an ear infection or something. I don't remember now at the time, but literally everything she needed was under this one umbrella. And um, a few years went by, and as mental health started to increase, I was in the field at the time, and I was saying, we really need something like this for the mental health field. And as the mental health as mental health started increasing, and I saw the gap in the mental health field was when people call for services. By the time a person takes the courage and build up their courage to make a call, of course, the waiting lists were getting longer and longer and longer. And I'm saying, by the time a person gets help, they don't need help anymore.
Right.
Whatever the situation is either over, they've worked through it, or they're so discouraged that they had to wait so long, they don't want help anymore. And so, um, that's how the urgent care process came about for mental health. So we want to get back to a person within the first 24 to 48 hours of their phone call. And we try to get them seen, connected with a therapist, get them in and provide counseling, or connect them with a group, so that they can get, in to see someone, to talk to someone within their first 24 to 48 hours.
So, if I am having a meltdown or I feel like I'm suicidal, is your service, can you help me? How would you help me?
So, for a person who is suicidal, and we get that all the time, so that person would be considered a person in crisis. And so I want to just clarify, a person who's in crisis is a person who is suicidal, or a person who is homicidal, right? Or a person who is what we consider a danger to themselves or others. Okay.
Mhm.
They are threatening people, threatening themselves, um, you know, hearing voices, having a paranoia um, episode, or anything that could be consider a danger to themselves or others, severe depression, which could possibly lead to suicidal ideations or threats or whatever the case may be. So those types of situations are considered crises. And those type of situations should be dealt with by contacting 911 or their nearest crisis center. And so um, normally what will happen if a person is in crisis and they contact us, one of our staff members will direct them to contact 911. Now, if we have someone that calls us and they are in the process of saying that they want to take their life by suicide, of course, we're going to keep them on the phone until we can get someone to where they are to a point of safety. But we do not provide crisis services.
Okay. So walk me through, because when I think of urgent care, it's a building. I can walk in and, like you said, get seen immediately or pretty close,
Mm,
to being seen. I'll get seen. You will diagnose me, or there are cases they may prescribe medication or give me some crutches. So, what is it that you offer? Kind of walk us through, those that are watching, really what is a mental health urgent care facility, because that's new to me anyway. You're the first person, the only person that I actually know that has that. So kind of walk. I know each day, each situation is different, but kind of walk me through at least one example of what happens. How does it start when your facility, and even what type of facility you have?
sure. So, I go by the mental health medic. Okay. And so prior to the pandemic, someone, we were doing most of our work in a brick and mortar. Okay.
Mhm.
Of course, after the pandemic, most of our work is now done virtual. Okay.
Oh,
And so let me just say we've actually been very, very successful virtually. Okay. And so a person will call, will handle their call, will take their information. The assistant will take their information, will assign them to one of our therapists. Okay. Uh, will schedule their appointment within 24 to 48 hours. Now, there are times that does not occur, but it's not because we can't get them in, it's because it's not convenient for them. Okay. But,
mhm.
that appointment time is offered within the 24 to 48-hour slot. Okay. They are seen. Now that we are accepting insurance, because let me just say, when we first started out, we were private pay. And we ran a very successful practice being private pay, believe it or not.
Wow.
Now we are accepting insurance, so we get quite a few. Of course, we get many more clients. Okay,
Mhm.
um, because we're accepting insurance. So if this person is coming via insurance, then of course we have to verify their insurance. We'll take the insurance, to make sure that their insurance is validated.
Mhm.
Because of that process, and we do explain that to them, if they definitely want to go through insurance, that process may take a little bit longer because now we have to verify the insurance. If they do not want to go through their insurance, because some people may opt, listen, I really want to get in, I want to be seen, I don't want to wait for insurance, I'll come in, I'll pay, and then once my insurance is validated, then I'll switch over to insurance. um you know we'll we can work it out that way. And then it depends on what they want to do, whether they want individual counseling, whether they want groups. We offer a lot of groups, right? Um, they'll come in. Now, because of different specialties, we do assessments, right? Um, so they may want assessments. We do not have a psychiatrist on staff to date, so we are not able to write prescriptions. I will let the clientele know that. However, if there is someone that needs prescriptions, I do have people that I can refer them to. Okay. But my practice does not have a psychiatrist on staff to date. And so we are not able to write prescriptions. Uh, but, when we refer to other psychiatrists, they can, get prescriptions. They can go to the psychiatrist and get the evaluations for the prescription. And so that's basically how we operate. Um, However, there are other, urgent care, mental health urgent care, or mental health practices that provide more urgent services is on the rise. It's popular now, right? And so, a lot of people are doing it, and they're doing it differently. But that's how we basically operate. And we're adding new services every day. I mean, well, I shouldn't say every day, but we're adding new services all the time. I'll say it like that.
Oh, okay. So I'm still trying to get an understanding. So um as the individuals, so now they've heard of your practice. So it sounds to me like there is a number, if I'm having a mental health crisis or mental health event, I could Google and find you,
Absolutely.
and then I will call.
Absolutely.
And then from that, you would assess what I need or assess the services that might benefit me. And so you're kind of the connector for what I'm hearing to the other services, or do you offer personal services yourself with your facility?
So let me just say, we will take just about everybody. We'll take just about anybody except people who are in crisis and
Mhm,
people who are calling for medication. Okay. If
mhm,
it's someone, so for example, let's say you got a call and you lost a family member and you're distraught and you want to talk to someone about the level of grief that you're experiencing. We will
mhm,
take that call. We will take that individual, right? That's an
mhm.
urgent matter. Okay.
Right.
You were just in a car accident, you're looking for someone to process. It was a traumatic experience. We will take that call. We take, people who just are looking for counseling. We take
Mhm,
those calls. The ones that we will not take are the ones that are in crisis, such as the
mhm,
ones that I described that are a danger to themselves and others. Okay.
mhm,
Those are individuals who need a higher level of care. Okay. um, and ones who are specifically saying, I need to speak to someone because I need a refill on my medication. We
right.
won't take those individuals because we can't write for prescriptions.
Right. Okay. Okay.
Okay.
And so I call you. I'm having a difficult time dealing with a trauma.
Exactly.
And so, are you like medical personnel that ask for insurance, or do you just have me come in first and assess if I can pay? What's the next step? I say, okay, I call you. I need to talk to someone. You say, okay, we have counseling services. So kind of walk us through that process. What happens after I call and you hear that I'm distraught from grief?
So when you make that phone call and you say, listen, I'm looking to speak to someone. So usually the call will go something like this. The person will say, I'm looking to speak to someone. I'll say, how may I serve you? That's usually my first question.
Hmm.
I'll say, can you tell me a little bit about what's going on? They may say, I'm looking at, I just lost my mother, or I just
Hmm.
lost, I don't know, my girlfriend or whatever. And I'll
Hmm.
say, sorry to hear that. How may I serve you? What are you looking to do? And they'll say, I want to set up some counseling services. And I'll say, okay, um, are you trying to go through insurance or are you private pay? They'll let you know from the door whether they want to do insurance or private pay, right?
But if I don't have any money, but I need some
We
help.
do take, believe it or not, we have taken people who are not in a position to pay full price. Now, we do not promote providing free services,
Right.
but on occasions, you know, we because we have people that donate, that will donate to our practice. And so we will provide on occasions, and I stress on occasions, and it's based on, those individuals are referred to me for my assessment, and it's not an ongoing process. So
Oh,
yes, if people don't have money, and that's not something that I necessarily promote, But,
Right.
if somebody calls in a situation, they just lost their mother, they just lost a child or something like that, and they, of course, are devastated or whatever, and
Mhm.
it's a financial situation, there are times that we've taken those cases.
Oh, okay. Okay. So
Mhm.
what type of credentials? What are you're Dr. Kidd, so what are your credentials that you
So
have for your
my individual credentials is I have 2 masters. I have one in human services, um, that is just a clinical human service. I have one in human services with concentration in public service leadership. I have my doctorate in Christian counseling. I have a
Mhm.
license as a professional counselor, and I have a license as a behavior specialist. I have 3 interns who have their masters. They are not licensed yet, so they work as pre-licensed clinicians under me. They're supervised by me.
Oh, okay. Okay. And you practice in the state of Philadelphia,
Pennsylvania. Yes.
Pennsylvania, yeah, Pennsylvania. And so in Pennsylvania, there's a licensing that's required through the state.
There is a license. So at this point, all of this, from what I understand, all of the states require a license. But yes, for Pennsylvania,
Mhm.
there is a license. We are required to have, um, a license to practice as a counselor.
Mhm.
Um, Now, you don't have to have the counselor's license, but you do have to have a license.
Oh, okay. Okay.
Yes.
And so when you open the business, is it listed on the medical, or how would I find you on the mental, or how would I find
So
you if
it's under mental health.
okay.
Um, if you were to Google me, you can find it under the name Finding Your Way, or you can find it under mental health urgent care,
Oh, okay.
or you can put my name in. If any way you put it in, it's going to pop up.
Oh, okay.
Yes.
And so what was your driving force that caused you to open this clinic, open this urgent care for mental health? What was your why?
So for me, as I said a little bit earlier, I've been at the time I was in the field about 25 years at that time.
Mhm.
Um, and one of the things that I noticed is that people just had to wait a really really long time. Personally, I had a family member that needed services, and they made an appointment, and that appointment was a year out.
Wow.
And I was just saying that is just so unacceptable. People are needing help, and are you telling me they have to wait a year to get services?
Mhm.
Like that
Mhm.
just didn't make sense to me. If somebody um and I was using myself for example. I know at the time that my urgent care was birthed, I was going through some physical challenges, and I was just thinking like if I as a heart patient, if I needed to see my cardiologist and I had to wait a year, that just
You
didn't
might
make
you might
sense.
be gone.
Yeah. So, one of the things about society is we don't treat mental health um the same as we treat our physical health. For some
Mhm.
reason, we don't see that it is um the equivalent, if not more important. Sometimes our mental health can dictate our physical health.
Mhm.
And I just felt like, we have to do something. And if we're not a part of the solution, we're part of the problem.
Right, right.
And we have to do something to fix the fact that it's not that people don't want the help. They want the help, but you're making them wait a year.
Mhm.
And, you know, um, it was my family member that had to wait a year. So my family had me as an advocate
Okay.
to say, no, we're not waiting a year. Y'all want to fix this, right? But
Right.
what happens to the people who don't have a me in their life?
Mhm.
And so that's what made me say, we have to do something about this. This is just not going to this is just not going to work.
Wow. So how long from for those that are watching, because there may be someone else that in other states that's watching, that, like me, have never heard of this, but there is a need. And if oftentimes when you have a burden for something and there's a need, then you may be the solution or one of the solutions. So, what advice would you give someone that hear how successful you are and what you're doing if they wanted to start something like this? Do you mentor? Do you have a mentorship program to establish one in other states? Or just, just talk to that person. Say, I like what you're saying. I understand because I've been on that side. Could have said, okay, needed help. Could have had a family member, like you said, that needed help, and there are other people because it is, and you go through so many hoops sometimes. Like I said, trying to get an appointment, trying to find out who, I know just some simple things that I may call this number to think they can help, and then they refer you to another number, and you just going in circles. And if you don't, I always say, have the patience of Job. You'll get very frustrated and just give up.
Exactly.
So just share some advice that you would have, or do you mentor, or how did you overcome those things? I know there's a bunch of questions in there, a bunch of things for you to answer, because this is fascinating to me. What you've embarked upon and how God has really blessed it.
No problem. So one of the things that I'm a big proponent of is anything you get in life, you have to advocate for. And one of the things that I have learned, and um, our coach has taught us well, is if it was easy, everybody would do it, right?
Mhm.
And so one of the things that we have to always be willing to do, and yes, it's hard. We get frustrated, we get discouraged. Trust me, I do. And we need somebody to give us that, B12 shot and say, come on, get back in
Mhm.
the game, do it, whatever the case may be. But, yes, I do mentor people. I have had people, some of the very eight organizations that is doing the mental health urgent care consulted with me.
Wow.
um, so you know, the problem, the difficulty is I was the first, so I didn't have a roadmap. But the good thing is, um, some of the other organizations that have shown a desire to do it have consulted with me and said, okay, how have you done this? Now, here's the thing: every organization is going to do it differently according to
Mhm.
their mission and vision.
Mhm.
Um, but yes, absolutely, I would definitely admonish, it across the U.S. I think it is imperative that we um, do. I think we need to have at least one or two in every state, to be honest with you. Okay. Um, I absolutely would be willing to mentor and to help people set them up in their various states, because, I can't be in 50 states, right?
Yeah, right.
But I think that it is, if we are going to, um, fight this pandemic, if you will,
Mhm.
because mental
Mhm.
health is a pandemic, right?
Mhm.
If we're going to fight it and overcome it and really help people live well, their lives in a state of wellness, yes, we have to pull together, and we have to have different arms and legs and chapters and all of those things and
Mhm.
practices, uh, that satellites, if you will, that
Uh-huh.
are willing to house it. People have the credentials. By all means, they should do it. Once you get started, you can hire the staff to do the work.
Right, right. And I guess, and my all the I said my little hamster wheel is just rolling along, listening to you, because I'm thinking about, okay, like like for me, my background, I have an MBA in business administration, but not the mental health piece. I have a
Absolutely.
Christian counseling certification. I'm not sure if it's certificate. I have to look and see if it's license or certification because I don't even use it anyway. And I'm thinking of a good friend who is in another state, who is a licensed, she is a registered nurse, a nurse practitioner in the mental health area. So saying all of that, and then another colleague that is a registered nurse, mental health, that's working on her doctors as well. So saying all of that, my question is, what qualifications do I need if I wanted to open something like this? If someone wants to open something like this, what what is it? At least the minimum that I need to know, because I, like, for me, my background is accounting and human resources. So I haven't really, and I've had some mental health training and trauma certification and things like that. As far as the public sector, I have not worked in health and human services, any of that, even in the medical field. So, what advice would you give someone like me that said, okay, I hear what you're saying, there's a great need, I'm in ministry, and to take it to, or to do something in my area, what is the least credential or experience that you think I would need to start something like that?
So, I mean, for you, you have what you need to start. You have the human resource background. You could actually start the business, and then you would get a therapist who's credentialed
Oh,
to be
okay.
your therapist, right?
Hmm.
Um, because the therapist, the point of the therapist is to do your billing
Oh, okay.
and to see your clients, right? And so that's how you would do it. And
Mhm.
you could you because you have, so here's the thing, and that's the whole thing. The therapist, I was a therapist already.
Mhm.
And so that was my advantage, that I was already a therapist.
Oh, okay.
Okay. um but if I wasn't a therapist, I could have still opened a mental health urgent care. I just wouldn't be doing the clinical work.
So, are you doing the clinical work now?
I am doing the clinical work, but the whole reason that I do supervision, or that I have the other therapist that I'm doing the supervision for, or the intern, is because I'm not going to always be doing it, because I'm going to be doing just what we're talking about, helping other
Right.
people have their practices, start
Mhm,
their
mhm.
practices, right? So that's what I'm saying. Everybody that has them, they're not therapists.
Wow.
Yeah. Or
Man.
put it like this: everybody that has a mental health practice, just like
Mhm.
every hairdresser, or every hair salon owner, is not a hairdresser. It's
That's
not a
true. That's
it's
true.
not a hairstylist, right? Um, every every car dealership owner doesn't know about cars.
Right,
They just a
right.
good business person,
I see. Wow.
right?
This is so good. I have
Yeah.
never, like I said, I knew you started it, but didn't really understand what it was. But now this sheds a whole lot of light, and like something brand new, never heard of, and that's
Right.
great. How
So like
long?
I go around, and so let me say this, Apostle. One of the things, before I even started the practice, I was going around to ministries, to churches, just talking about mental health.
Mhm.
And so that built up a lot of momentum. So I was, literally, and you don't know how amazing it is that you called me this week, because literally just this week we were going through all of the pictures and all of the archives of how all of this got started. And we're in the process of working on a project to put all of that together. And we were looking at the very first conference I did, because this is our 7th year, and
Okay.
we're getting ready for the 7th conference. And
Mhm.
so I started out, bridging the gap between faith and mental health,
Wow, I like
because
that.
as
Yeah.
a bishop, as an apostle, that was another gap. We know how to jump and shout and lay hands and do all of those things in the
Mhm.
church. When we are ordaining people, and we are getting people ready for ministry, we make sure they know all that protocol and all that
Mhm.
stuff. We make sure they know that. But
Yeah.
can they handle the weight of ministry? You know,
Wow, that's
when
true.
people are betraying them, when people are leaving, when people are talking about them, you know, I say this all the time. We often say we emulate Christ, but do we really? Because to emulate Christ, that comes with a bunch of betrayal.
Uh-huh.
That comes with the very person you fed betraying you. That
Mm-hmm.
comes with a whole lot of, you know, you're gonna you're gonna facilitate healing in a lot of people's lives, and then they're gonna turn around and talk about you.
Right, right, right.
Do you understand that? So can you hand outside of the mic, outside of when those lights are glistening and making you look at
Uh-huh.
your best, can you handle the weight of ministry?
Yes.
That's
Ooh.
when the depression sets in.
Mm-hmm.
So before I even opened the urgent care, I was going around to ministries doing that, bridging the gap between
Wow.
mental health and faith, because leaders were dying under were crumbling under the weight of ministry,
Mm-hmm.
right? And
Wow.
nobody was talking about that, right?
Right. They weren't. They weren't.
But now look, everybody's talking about it now.
Yep. And before they were ready to pray, which is good, but no one talked about it. I remember the closest, and really I didn't attend the conference, but I remember years ago, Bishop Jakes had a conference or a book or something called Where Shepherds Go When They Bleed. You know,
Hmm.
you're not supposed to bleed on the flock, but who can the shepherd go to? Who can leaders go to when they're feeling like they don't want to do this anymore? I'm doing this because this is what God called me to do. And the thing that they don't share often is that pastors don't want to do it either. They get tired too. Although the members expect you to be there for everything, but where can they go to get help? And then, in our culture, if you said you were having, you needed a therapist or to see someone, people look at you strange. I always say, like, you have three eyes in your forehead. Like, that's just taboo. But the great thing, and that now we're talking more about mental health and trying to understand what that is, and that it's okay to have someone, especially someone professional, talk to. You back in the day, I would talk to my girlfriend. She may not have given me the right advice or not, but we had that friend that we talked to about everything. But it's so good to know that this is something you that you're doing, and that you're open to share and come in and teach and train to the HELSA seminar or something like this. This has been so good. Anything else we
I
want to
have a
share before we
question.
close? Uh-huh.
And I ask this question a lot of times when I go to professional arenas and churches. You know, we as in church, we just what you said. You know, counseling has been frowned upon.
Mm-hmm.
But if Christ didn't want us to have counseling, there's a scripture that tells us there's safety in a multitude of counsel.
Mm-hmm.
That's in the Word of God,
It is. It
right?
is.
So he's telling us there's safety in the multitude of counsel. So right there is letting you know, get counseling. Don't
Mm-hmm.
don't go on your own. What does he say? Lean not
To your
on your own
own
understanding.
understanding. That's it. That's
Because
it.
he's letting you know your stinking thinking is
Yeah.
gonna get you in trouble, right?
Yep.
And so and that's the whole thing about bridging. The Bible is all through the Bible. How we can govern ourselves, get counseling, you know, and still be aligned with the Word of God. Trauma is all in the Bible.
Mm-hmm.
And so it's nothing new under the sun. We
That's
just
it.
got to know how to, apply it to our lives. And
Mhm.
so all of that, that's how all of it was birthed. All of
Wow.
it, you know.
Wow.
Um, making sure that we take care of ourselves, making
Mm-hmm.
sure that we take care of our families. When Christ was on the cross, one of the last things he did was make sure the brother was taken care of and his mother was taken care of. So
Mm-hmm.
why do we think it's such a bad thing when we take time to take care of our families?
That's it. Yep, that's so good.
right?
So, if someone
So
wants to reach out to you, how do they connect with you? Because this has been so good. I'm sure there'll be people that are watching now and in the replay, and they'll forward to friends that want to hear more about what you're doing. Maybe invite you in to share. Uh,
absolutely.
so, how can they find you? Where can they find you?
So, as we said earlier, any way that you Google me, it'll pop up. So they can Google the organization Finding Your Way LLC, or they can Google Dr. Kia Everett. Now, make sure they do Dr. Kia Everett, because if they just do Kia, the car will pop up. Okay, so they have to do Dr. Kia Everett. Or they can go to my website, www.findingyourwaynow.com. Okay.
Wow.
Or my phone number is 833-646-3342. And of course, I'm on all social media: LinkedIn, TikTok, Facebook, Instagram.
Wow. This has been so powerful. I just want to thank you again, Dr. Everett. And of course, I'll be calling you offline because I have a whole bunch of questions and stuff. And who knows, what is churning on my little hamster wheel that what's next, because this is just, for me, it's just so eye opening to what's going on and what you did. Like I said, I've known you for quite some time, and I knew you had the urgent care. So I'm thinking, okay, just 24 hours, and that's another thing. Is it 24 hours?
It is not 24 hours. Um, so, of course, it's by appointment only.
Hmm.
Um, but we do have evening program. So if somebody's
Okay.
in a situation in the evening, they can call and get an appointment, in the middle of the night.
Oh, that's great to know. That's great to know. And like I said, once again, thank you so much, Dr. Everett, for
Thank you
being
so much for
on.
having me.
Yes, this has been so enlightening, and I'm sure we'll have a bunch of questions. And I definitely will be checking in with you to see something else we can put together, maybe in the Texas area. You just never know, bring you down. But I'm gonna try to bring you when it's not as hot. Bring you
Okay.
when it's not as hot. Well, thank you again, everyone, for watching. And those of you that are watching the replay, I'm your host, Apostle Gretchel Dixon. Y'all have a great night and a great week. God bless you.
God bless.